Angina is a symptom. It's a pain or an uncomfortable feeling when blood flow to your heart is reduced. It's not dangerous, but it can be a sign of heart problem, like coronary heart disease. It's usually felt in your chest, but some people feel it in the pain in their arm, neck, stomach, back or jaw. The symptoms of it. Angina usually feels like pressure, tightness or squeezing in your chest. This can be painful or like a dull headache. You may also feel it in your shoulders, arms, neck, jaw, back or stomach. Other symptoms of angina can include fatigue, dizziness, sweating, feeling sick and shortness of breath. Getting help. If you've not been diagnosed with angina and you have chest pain that stops after a few minutes of resting, get an urgent doctor's appointment. If the pain does not stop after a few minutes rest, call 999 immediately because you can be having a heart attack. If you've been diagnosed with angina but it feels worse, happens more often as it's changing anyway, talk to your doctor as soon as you can. If your chest pain doesn't stop after a few minutes rest and 1 or 2 doses of your nitrate medication, you should call 999 immediately. Are you finding it hard to get medical help? We know that many people are experiencing delays to treatment at this time or have questions and concerns about getting medical help, and the BHF have created this set of information to help you with these issues that is on their website. The types of angina include stable angina, unstable angina, vasospastic angina, microvascular angina. Stable angina. This is the most common type of angina. It tends to happen when your heart works harder, such as you're walking uphill, and goes away when you rest. You'll usually know when it's likely to happen, and the pain or discomfort is similar to what you've had before. Stable angina lasts 5 minutes or less and improves if you rest or take your medication. Unstable angina can feel different to your normal angina symptoms. It can happen even when you're resting. An unstable angina feels more severe and lasts longer. Your symptoms might not improve when you rest or take medication. If your symptoms don't improve when you rest or take medication, you should call 999 immediately. Vasospastic angina, also known as coronary artery spasm or Prinzmetal's angina. Vasospastic angina is rare. It can happen during the night when you're resting, when a coronary artery supplying blood and oxygen to your heart goes into a spasm and narrows or tightens and lets less blood flow. A microvascular angina, also known as cardiac syndrome X, usually happens when you're under physical pressure, like when you're exercising or when you've been stressed or anxious. This pain is often caused by spasms in the smallest coronary arteries, restricting blood flow. Angina symptoms for men and women. Both men and women can experience the same symptoms of angina. These include the classic chest pain and pain in the jaw, neck, back or tummy. But in general, women are more likely than men to develop less common symptoms like feeling sick, sweaty, dizzy and breathless, and microvascular angina, spasms in the smallest coronary artery. The cause of angina, the most common cause of it, is coronary heart disease. This is when the arteries that supply your heart muscle with blood and oxygen are narrowed by a fatty substance called plaque. It means less blood flow to your heart muscle and can cause angina symptoms. There are common triggers for angina pain like physical stress, emotional stress, cold weather or eating a meal. The risk factors for angina include stress, smoking, diabetes, obesity, high cholesterol, high blood pressure, family history of heart disease and older age, 45 plus for men and 55 plus for women.